Tell me about the announcement today.
Well, governments had to make the very difficult decision to impose further lockdown restrictions across the province of Ontario, effective through till January. It's really difficult. I mean, we're cognizant of the effect that this has on individuals, but it was necessary to take decisive action. We all listen to constituents, and you've got to balance what you hear from businesses, what you hear from the elderly, what you hear from your frontline workers. Bottom line, when it comes to the integrity of our healthcare system, I lean on the healthcare workers in that system. And when I hear from our hospitals that they're very concerned about capacity issues, when we hear on round tables that the Premier's had with all of the hospital CEOs that there's a very real concern over ICU, critical care capacity, we have to act, because the imperative is to act decisive and act decisively now, because we know we're not going to risk. I'd much rather have a conversation about supporting a business with access to fixed costs, electricity support, rent support, wage subsidy support, additional cash through the Ontario Support for Small Business, than I would talking to that business owner about a deceased loved one.
The government, from what I've seen, again, this is we're in a new world, but the government's trying. So we've tried to not do this. So it's, I don't know whether I can say last resort, but it's pretty well a last resort to do what the government has decided to do.
Yeah, I mean, nobody takes any enjoyment in doing any of this. This is a very difficult decision that governments had to make. But you elect this government to make difficult decisions. And what I would say is that we're doing, we're making these decisions, these very difficult decisions to protect the health and well-being of Ontarians, to ensure we act now so that when vaccine rollout in phase 2 into the spring and summer, we can have a summer. And we can have a summer, hopefully, with Ontarians, Canadians vaccinated, where we can start talking about once again becoming a destination for tourism, once again getting back out in our community. That's what I want, and we have to act decisively now. And let's not forget that the government's doing this amidst the backdrop of fixing the hospital funding formula, fixing the funding formula for our long-term care facilities, building a record number of long-term care facilities right now, addressing that funding inequity for decades that plagued our hospitals, giving them additional beds to support with the capacity, launching a staffing strategy that's committing to 4 hours of direct care for our loved ones that will make us a leader in Canada. We're doing all of this amidst the backdrop of a global pandemic, and supporting businesses through electricity support, fixed cost supports, reducing payroll taxes. I mean, look, this is incredibly difficult. There's no playbook. I wish I was anywhere other than making these decisions and being involved in this. But look, I was elected to represent the constituents here. I listen to everybody. I'm far from perfect, but you listen to everyone. Try and make the most informed decisions after listening, up all hours of the night, listening to constituents and everybody having their say.
Hopefully this will give a chance to sort of the province have a reset and then get the vaccine going.
Yeah, I mean, this sort of circuit breaker lockdown right now so that we can then get back to things in the new year. And with the vaccine rollout, I'm confident 2021 is going to be a better year than 2020. But look, we've had to act decisive. We've had to act now. And again, Ontario cases, how we've responded to date has ensured the integrity of our hospital systems, that people can get the elective surgeries, the screenings for prostate cancer, mammograms, other things. I mean, it's important that we ensure the integrity of that system. And you stack up Ontario, not against PEI or Nova Scotia, and not against a red herring. Someone will point, oh, well, New Zealand's done this. Yeah, it's an island of 4 million people. We're Ontario. We have Pearson Airport. We're a major trading hub. We'd be one of the largest states if we were in the United States, and our record against major United States is a far better one. I'd rather be in Ontario than any of those other states. And look, we've got a lot of work to do. It's difficult, and it's not going to be easy, but we've made decisive decisions to protect the health and well-being of Ontarians, and we're going to bounce back even stronger than before.
One of the things that I found over the last few weeks is that even though places are in lockdown or red zones or in the GTA area, I don't think it helped when people came down here. Now, I've told you a few stories about that, but it's just unfortunate now because we're starting to get, we are getting a lot more than what we had of cases. And I think people wish if they would have stayed in their own, quote, zones when that was happening, I think it would have just been better. I don't
Yeah.
know whether that'll come off or not.
Well, when you talk to me about this, and I listen to my constituents, I think of June, who works at the Service Ontario Centre out in Brighton, who told me that, look, I've got 20 people coming in from the Peel region to renew driver's licenses, etc. That's putting her at risk. That's putting, the elderly, especially in the Brighton region, at risk. And we have seen that. And I don't blame people. They want to get out. There's angst. There's COVID fatigue. But again, we have to act decisively to protect the health and well-being of Ontarians. We have an elderly population here in Northumberland, and I know, we choose to live in rural Ontario, and we choose to live here for a reason. And so we want to maintain, what the little slice of paradise that we have here. But the growing case count, specifically in Northumberland, was very concerning. And when I lean on the experts, the healthcare professionals, they tell me this is concerning. We must act, and we must act decisively.
If you can, and if you don't mind, I'll probably jump around a little bit, but one of the concerns that was brought up, and I don't know how much we can get into it or not, but everybody worries about the small town stores making a living towards the big box stores. And one of the concerns, I believe, last time when the province had to shut down was that the small towns, say, if I use an example, clothing stores were shut down, but you could go into the big box stores, e.g. Walmart, and shop for clothes. In other words, it wasn't just for, quote, essential items.
Yeah, I understand. I mean, look, it's frustrating for small business owners, and what we've done with this lockdown here is we've imposed strict requirements for stores that sell grocery. I mean, it's been a little more open for the strictly grocery stores, and then strict restrictions on those that do have a partial grocery element, but like big box retailers like Walmart's and others, 25% capacity, again, very strict restrictions, and we're encouraging people, please, get out, make one trip out. I mean, what we know is, look, if you can limit the number of times people are going out, it's better. We want people to stay at home as we get through the holiday month here and through these restrictions, and then let's get back to our life and the vaccine rollout across the country. But for this, it's trying to limit the number of times one would leave the house. And that's it's difficult. I get it, and that's why that Ontario support for small business up to $20,000 is designed not for a big box, but for small retailers. In addition to rent supports, wage supports, electricity supports, and I would really say, and it's important, and I appreciate you giving me this opportunity to small businesses, reach out. We're here to support you through this month, and we've designed a program not to wait until the end of January, but to get supports in your hands now.
If I can ask, and it's been brought up to me, and I brought it up to you, and I don't know how much we can get into it, but I'll ask and see where we can go. People are frustrated because they're finding out things more from the community social network than they are the health unit network. And that's getting, even today, Shoppers had a case, but the press release came from Toronto, and it only sort of gets out, I wouldn't say accidentally, but it gets out through word of mouth. There's more people becoming frustrated with the local health unit. Have you heard that, I guess? Have you heard that? And can you share what your thoughts are?
So what we've had discussions as mayors, I mean, I've convened a discussion table with all levels of government and brought in public health to address issues like this, to address a wide variety of issues. And one of the things on the communication piece, I mean, I've called in caucus for a standard dashboard. I've called for a standard dashboard through which we display information across the province of Ontario to maintain a level of consistency. We've also talked, the idea is we got to get that information in the hands of people right away. Ideally, yes, it all comes through the same medium. But we've talked about this, and there is no playbook for this. So Health Unit are working diligently trying to get contact tracers out and working with it. And from time to time, a corporation that hears through either, some are testing their own employees independent of our healthcare system, and we've rolled out a number of of testing centers, I should say, throughout Northumberland. So from my perspective, do we have a table through which we can address these issues, and are we all, admitting areas we can improve? Yes, everyone's been very collaborative in that respective, and I continue, and we continue to have a forum where we can address these issues. Last
question. Obviously, everybody's stressed, like you say, COVID fatigue is, to say, a minimum fatigue, but you and your staff, what came out last week about how death threats, people don't have to agree with the government by all means, but there must be, you have to be cordial. Everybody's doing their best. This is a one-time, this is a first-time thing. Talk a little bit about how, if you can, how that has affected you and staff.
Yeah. Well, look, we get up every day coming in, trying to serve the people we represent. When I got elected, I made a real key piece being the service element. And I think a lot of people out there would say, they might not have got or agreed with me on an issue, but I tried my best to get back to them. If I didn't, I acknowledged it and still reached out and made a contact point. And I really take the service element of public service key. The constituents are our boss, but I've got a remarkable staff here who get up each and every day trying to help the residents of Northumberland, Peterborough South disproportionately. These are positive interactions with residents. But the sort of bullying that we saw and the issue that arose over this incident where death threats were leveled and very serious ones involving the police aren't something any public servant, regardless of where you work in government, should have to deal with. And for my staff, who work very long hours in the middle of a global pandemic, it's not acceptable. And their health and well-being. And what the real loss here is that we have an open door policy here. Now we've got to lock the door. Police said lock the door while they're investigating this issue. And at the end of the day, the people we represent suffer. The single mom trying to access support, from staff here, from Bonnie helping a mom access those supports. They suffer when issues like this happen. And to the person that leveled that, I hope they get the mental health supports that they need to overcome this, because it was just unacceptable.
I've always said it's okay to disagree. Nobody is, we don't have to always get along, but it's just the respect factor is there. And I've always said, for decades, education through communication. So yeah. A rant isn't going to solve anything with that. It's just a work through communication to see, understand both sides. I guess it's about understanding both sides, if you can just end it with that.
And that's what the promise, I believe, of Canada, of Ontario, the fact that, a few generations later, someone whose family, escaped fascism in Europe, is now sitting a member of the legislature, and we did that because we don't have the disgusting sort of polarized debates that we see in other areas. That's what's good about Canada. So for everyone, before you get behind that keyboard and act all tough, just think, maybe, can I pick up the phone, or can I, go back and forth in an email? And I just think we'd all be better off for that, regardless of political stripes, regardless of the level of government. I think the pandemic has really exacerbated divides, really exacerbated underlying issues, and at the end of the day, we're, as politicians, we are held to a higher account. We get up, we're accountable to the people we represent. It's something I take very seriously, and I'm always open. If I wanted, not to make light of it, but if I wanted my back rub, I would go to St. Anne's or something. I embrace discussion, I embrace debate, and I embrace criticism. It makes me a better MPP, but it's got to be respectful. And this sort of stuff, death threats, are not tolerated.
Last question. Talk about a little bit about what you'd like to say to your constituents during this time. Talk a little bit about what you'd say, like, to the emergency services, to the healthcare workers, to the doctors, to the people that drive transports.
Yeah.
We're going to go through another round of this, but it'll get better if you can just.
Well, amidst all of this, I think we've seen really the best of what our community has to offer. We've seen folks looking after their elderly neighbor, dropping off groceries, folks who are self-isolating. We've seen, parades acknowledging, at Santa Claus at Christmas time, but acknowledging our frontline workers. We've seen those very frontline workers who are on the front lines of COVID still stop to acknowledge what's special, to acknowledge that 100th birthday, to still do the things that make us human, that make us the great rural Ontario place that we are to live, that we live in. and that hasn't stopped. And so amidst all of this, I try to focus on the positives. You know, the Brighton Legion that had a window display to thank our frontline heroes. You know, Sharps and others up in Campbellford who were the first on, you know, to support seniors in the community, to get that food out to those who need it. I think to, you know, everybody, you know, in our community who've acted, and the different networks that have come as a result, making masks for our frontline workers. So we've had a lot of positives. Government's taken lessons learned, and, you know, I again focus on the positives. We're not a province that is reliant on expired masks in a warehouse from China. We're making them here in Ontario now. We're making hand sanitizer in Cobourg. We've got great new masks out of Cobourg. So I focus on the positives, and again, Ontario will emerge stronger when this is done.